Ultrasound on a small baby. Age guessing? He's 2 years old. He has pain more in right hip joint in that area. And when I did ultrasound, I saw some fluid in anterior joint recess. So today I'm going to show you fluid in the anterior joint recess in a small baby that is only 2 years old. Okay, so this is femur. This is acetabulum. This is cartilage, and look at this. This hypoechoic area, this is all fluid. Usually anterior joint recess is not so big, and when there is effusion in the joint, we can appreciate that in anterior joint recess. We'll find fluid in the anterior joint recess, which is right there. So this fluid is not normal. Normally there should be no fluid, right? And I'm going to put some colors with that. It's always good to see, to do the color doppler, because when there is some inflammation or infection, there will be more blood flow. These are artifacts because you can hear baby crying and moving. So these artifacts are due to movements. So let's turn it off. And this is sagittal direction, right? Okay, this is all fluid in right hip joint. That's it. Thanks a lot.